In this video, we're going to be talking about depression. It's really common. It's something I see every day in the GP surgery. And unfortunately, we only have 10-minute appointments and it just isn't long enough to get through all of the patient's problems and then discuss all the possible treatments, because there is loads that can be done to help. So I was really keen to make this video so that you can watch it. You might need to watch it a few times. Please do watch it all the way through, because I think there'll be lots of helpful information for you in here, whether you yourself might be suffering from depression or it might be a family or loved one. There's still a stigma with mental health, unfortunately, although I think things are getting better. And it isn't just a case of pull yourself together and cheer up. Unfortunately, it's not always as easy as that. But there is a light at the end of the tunnel, and there's things that can be done to help. So let's find out. The word depressed is pretty much an everyday used word in the English language. People say like, oh, I'm depressed, oh, I've got to revise my exam today. And that isn't actually depression. That's just life's up and downs and life stresses that we all have to deal with. So depression is different. It's when there's a low mood that starts to affect people's quality of life. And it comes along with other symptoms as well, such as problems with sleep, change in appetite, feeling tired all the time, feeling hopeless, lacking concentration, not enjoying the things you used to enjoy anymore. And so all these problems come together, and that's when we can diagnose depression. So how common is depression? Well, you probably already know it's really common. It's about 1 in 4 women have depression so bad it requires treatment in their lifetime, and about 1 in 10 men. And it may be that there's actually more men suffering with depression who just aren't coming forward for help. Why do people get depression? Well, we don't know exactly, and anyone can get depression. It's likely that there's a genetic component, so some people are just more prone to bouts of depression. And also stressful life events, such as losing your job or a relationship breakdown, can affect depression. Most often than not, it's a mixture of the two things. So someone who's got a mild low mood and then has a stressful life event gets triggered into depression. We also know that physical health problems, chronic physical health problems, are a risk factor for depression. So as well as managing the health problem, the physical health problem, we need to make sure we're also thinking about the mental health problem. And then there's loneliness. Loneliness is a risk factor for depression. And unfortunately, loneliness has increased 50% in the over 50s in the last 10 years. And one study found that loneliness is as bad for your health as smoking 15 cigarettes a day. What can be done to help depression? Well, this is the good news bit, because there is lots that can be done to help depression. And lots of it you can even do by yourself without even visiting the GP if you don't want to. So the first one I'm going to talk about, I think, is the most important one, and that is exercise. And that's because we know that exercise is as good as antidepressants for mild and moderate depression. So you don't even have to have the side effects of the drugs and pills. You can just get out there and do some exercise. And we know the benefits of exercise. It can lift your mood. It releases endorphins, those kind of happy chemicals in the brain. It can improve your self-esteem. It can be a good distraction from negative thoughts. It can reduce your stress and anxiety. And if you exercise with other people, it can improve your social interactions and help avoid loneliness that we already mentioned. Now, the guidelines are 150 minutes of moderate intensity exercise a week for adults, which sounds like a lot, especially if you're struggling with depression and you're watching this thinking, I can't be bothered to get off the sofa, let alone do exercise. And I appreciate that. So what you've got to think about is what tiny amounts of exercise can you build into your day, and then work up from there. So set yourself little tiny goals, because anything you're doing will be better than nothing. The second thing you can do is try and improve your sleep. Depression can cause problems with sleep. You can be sleeping too much or not getting enough sleep. It's really important that you prioritize sleep, because we know that if you're sleeping better, you improve your mood and you have more energy. So things you can do to try and improve your sleep would be exercise. We've already mentioned that really helps sleep. Avoiding caffeine after lunch. Sticking to the same routine, so go to bed about the same time and get up about the same time every day. Cutting down on alcohol, especially too close to bedtime. And cutting down on screen time too close to bedtime. Little changes like that can make a difference to your sleep and therefore improve your mood. You can also think about your diet. Everybody knows that if you're unwell with a cold or something similar, the advice is to drink plenty of fluids and eat well. And the same is true for mental illness as for physical illness. So what you eat can really impact on your mood. In fact, studies have shown that trying to eat more of a Mediterranean diet, so lots of fruit and veg, and cutting down on processed foods and too much sugar, can really benefit and lift your mood. For some people, they feel low and rely on alcohol and cigarettes to try and give them a little lift. And it can at the time make you feel a little bit better. But in the long run, there are more negative consequences. We know that alcohol is actually a depressant. So try not to rely on this and try and cut down. Some people say it's a bit like stealing happiness from tomorrow. And just think about cannabis. Some people think that cannabis is pretty harmless and can help them relax, but actually there's lots of good evidence to show that cannabis is linked with mental health problems such as depression, so definitely best avoided. You could also download some apps that can be really helpful for your mental health. There is an NHS app library, which I will include a link to in the description below, and loads of apps for mental health problems, lots of which are free, and some studies have found that these can be just as effective as face-to-face therapy for problems such as depression. They can include things like mindfulness, breathing techniques, and kind of CBT-based stuff, so controlling negative emotions. So loads of useful stuff, and it's out there and it's free, so go and take a look. So there's loads of ideas there of what you can do to kind of self-help with your low mood and depression. So now let's have a look at what other help is available from the specialist teams or your GP. One option is psychological therapy, or a kind of talking therapy. And this can be in the form of counselling or cognitive behavioural therapy, or CBT. CBT is based on the idea that there's certain kind of negative thought processes that can make things like depression worse. So it aims at looking at that and preventing those cyclical negative thoughts. Your GP can refer you, but more often it's a self-referral. So I'll include a link at the bottom for where you can find out your NHS psychological therapy team and how to contact them. And obviously there's antidepressants. Now, a lot of people think that antidepressants are going to be the cure for their problems. And of course, sometimes they can help, especially in kind of moderate or severe depression. But if there's work and life stress going on, then they can't solve that problem. So what I often say to patients is antidepressants are a bit like the life jacket, so they can help you float, but they're not going to help you kick yourself to shore. You've got to do that by yourself. And of course, there are side effects, just like any medication. So some of the side effects of antidepressants include tummy upset, weight gain, and sexual dysfunction. So they can be quite significant. And of course, they don't help everyone. But for some people, they do help just give people a bit of motivation and an ability to get on with their life problems. So for some people, they really do help. Now, it's not a quick fix. We do recommend that you wait about 4 weeks before you kind of decide whether or not it's even working. And if you are finding them helpful, then we suggest you stay on them for about 6 months after you're feeling better. Medications we often use, you might have heard of things like fluoxetine, sertraline, citalopram, and mirtazapine. And if you do want to stop them, then please do speak to your doctor first, because it can cause withdrawal symptoms if you suddenly stop. So it's best to cut down safely. And there's also the community mental health teams. And again, your GPs can refer you to these if necessary. And this is for people who are struggling with more severe depression. And this is made up of psychiatrists and psychologists and specialist nurses. And they can provide more specialist intensive talking therapy and, of course, medication as well. I thought it was also useful just to mention work and finances. For a lot of people, they need a bit of time off work because either their work is what's causing them to be stressed, or their low mood is impacting their ability to do their work. So sometimes just a little bit of time off to recover can be really useful. But studies do show that prolonged time out of work can actually make depression worse. And actually there's lots of positive things about getting back to work to help with your low mood and depression. It can improve your self-esteem. You can obviously make new friendships and avoid loneliness and isolation that we mentioned. Obviously there's financial security. Money's always useful. And also it just can help you feel like you're playing an active part in society, which can really positively impact your mental health. So if you're struggling, maybe speak to your employer about, is there different hours you can do if that's a problem, or is there parts of your job that you find specifically stressful or difficult that can be amended? Often there's ways around it to make sure you can get back to work safely and happily. So I also need to mention that for some people who are struggling with severe depression, they can even have thoughts about self-harm or even ending it all and taking their own life. So if you or someone you know is feeling like this, then please don't hesitate to contact your GP or call 111, or you can call Samaritans on 116 123, that's 24 hours a day. There's also local mental health teams, and I'll include a link in the description so you can have a look and see who your local emergency mental health team is, and they will also have a 24-hour access number. Because unfortunately depression is common, and I see every day so many patients are really negatively impacted by it. And obviously we can help the ones who come forward and ask for help, but we can't help people who don't come forward. So please don't sit alone thinking you've got no one to speak to, thinking you're alone in the world, because you're not. And there is always help, whatever time of day or night. There's always help available. So please do reach out and get that help. Okay, I hope that's helped. Please share this video with anyone else you think might be struggling or might find it helpful. And take care of yourselves, and I'll see you in my next video.